Okay. Welcome, everyone. Thank you for joining us. My name is Roshanak Medapana, and I'm the Director of the Housing Solutions for Health Equity Initiative, housed in the School of Public Health. Thank you for joining us for our Housing Solutions Speaker Series, where we highlight housing research and its connections to health and health equity. For those who are unfamiliar with what we do, the Housing Solutions for Health Equity Initiative informs local, state, and national policy through interdisciplinary research on housing as it relates to equity in health, race, socioeconomic status, and aging. I also want to say Eid Mubarak to all those who are celebrating today, and thank you for joining us. Before we start, I do, however, want to acknowledge the detrimental impacts of war on people's well-being, but also its consequences of displacement and loss of homes. More than ever, do we see the central role a home plays in providing safety, security, and status, and the consequences of having that taken away. Today's speakers will be largely today's speakers will address some of these inequities by discussing how in the U.S. policies and programs have enabled gains among largely white communities through generational wealth accumulation while taking away opportunities from Black, Brown, and Indigenous folks. In a recent report that HSHE completed in partnership with MISHDA, we found that 34% point difference in white and Black homeownerships here in Michigan. Housing Solutions prioritizes engaging in research that addresses housing and health equity because we believe access to adequate housing is a human right. So today, our speakers, Dr. Helen Meier and Jasmine Simington, will focus on unequal access to homeownership in the U.S., as well as support for reparations among 3 Michigan communities. The session will be moderated by Dr. Mara Ostfeld. Throughout the event, feel free to submit your questions to the Zoom Q&A, and we hope to answer them during our Q&A session at the end. I also encourage you to use your side-by-side speaker setting on Zoom to see and hear our speakers today. So first, I have the pleasure of introducing Dr. Ostfeld, who will moderate the event. Dr. Mara Cecilia Ostfeld is the Research Director at the Center for Racial Justice and an Associate Research Professor in the Ford School of Public Policy at the University of Michigan. In addition, Mara is a faculty lead at the Detroit Metro Area Communities Study, or DMAC, an ongoing representative survey of Detroit households that asks residents about their expectations, perceptions, priorities, and aspirations. She's an expert in survey research and the analysis of public opinion, with a particular focus on the relationship between race, gender, media, and political attitudes. Welcome, Dr. Ostfeld.
Thank you so much, Roshanak. And thank you to you and the entire team at the Housing Solutions for Health Equity for organizing this wonderful and very timely panel. I'm truly thrilled to be here today, and I'm grateful to have the opportunity to moderate this important conversation on the historical elements of housing access and how that shapes so many aspects of our social, political, and economic experiences in America today. We're going to begin this webinar by introducing Dr. Helen Meier, and I'm going to then turn it over to her for a brief presentation on her work. After that, I'm going to introduce Ms. Jasmine Simington, and then turn it over to her for a brief presentation of her own work. We'll bring our presenters together for a question and answer session at the end on their individual research, as well as the many areas that it overlaps. So with that being said, I'm excited to introduce Dr. Helen Meier. Dr. Meier is an assistant research scientist at the Survey Research Center at the Institute for Social Research at the University of Michigan. Her work examines the structural, social, and environmental determinants of health and health inequities across the life force. Her overall goal is to understand how social vulnerabilities become biological vulnerabilities, resulting in health inequalities. Dr. Meier is a molecular and social epidemiologist, and the breadth of her work from cells to society reflects a biosocial approach to population health. Thank you.
Thank you for that introduction. I'm Helen Meier, and I'm an epidemiologist by training who's found my way into investigating housing and health. We know that home ownership is a major source of wealth accumulation in the United States. And we also know that minority neighborhoods have faced decades of discrimination in the housing market that have prevented equal access to home mortgage loans. The ability to measure home mortgage lending discrimination has been hampered, however, by the lack of longitudinal data. So today I'll introduce a new resource for facilitating studies of mortgage lending discrimination and discuss applications of this data set. So before diving into the presentation, I want to acknowledge my collaborators. In particular, I want to acknowledge my colleagues at the National Community Reinvestment Coalition, or NCRC. This work is supported by an NIH grant, and my partners on this grant, particularly Bruce Mitchell and Jad Edleby, took the lead in creating the data and tools I'll share with you today. And so I just want to make sure that they're recognized for their substantial efforts up front. So my partners at NCRC and I have spent a lot of time studying historic redlining and neighborhood health indicators. And I know redlining has been a topic of previous housing solution sessions, so I won't spend too much time on the background here, but just in case anyone attending today is unfamiliar, redlining is a term that describes the discriminatory practice of denying minority populations access to equal loan and housing opportunities. And the redlining that most of us are familiar with, and in the example that I have here on the screen, is the Homeowners Loan Corporation, or HOLC redlining. HOLC was a federal agency created under the New Deal in the 1930s in response to the Great Depression. Between 1935 and 1940, HOLC created residential security maps of over 200 major US cities to inform local real estate on mortgage security. HOLC field agents collected data on neighborhood conditions, housing and demographic characteristics, and local real estate factors to inform these neighborhood grades. And I have an example from a Milwaukee neighborhood here on the screen as well. Through this grading process, HOLC residential security maps standardized racially based appraisal methods and pioneered the institutional logic of residential redlining. So we've previously not only demonstrated associations between redlining and current distribution of socioeconomic factors, but also found associations between historic redlining and numerous health outcomes, such as poor physical and mental health and higher prevalence of chronic diseases. And then I have an example here on the right-hand side with our partner, Rob Nelson at the University of Richmond. We've developed web visualizations of historic redlining, area descriptions, and current neighborhood sociodemographic and health conditions, and CDC's Social Vulnerability Index. So we're making connections between redlining and present-day health. However, a major gap in the research is understanding the mechanisms and processes linking historic redlining to current health. Some examples of these mechanisms or processes might be pollution, the physical environment, racialized displacement and segregation, and discriminatory lending. And so today in this presentation, we're going to focus on modern lending discrimination. To measure discriminatory lending, we can turn to the Home Mortgage Disclosure Act, or HMDA, data. So HMDA was enacted by Congress in 1975 and requires many financial institutions to maintain, report, and publicly disclose loan level information about mortgages. HMDA was initially implemented by the Federal Reserve Board and is now overseen by the Consumer Financial Protection Bureau. There's an annual release of data on loan information, and these data help show whether lenders are serving the housing needs of their communities. They also give public officials information that helps them make decisions and policies. And they shed light on lending patterns that could be discriminatory. The information reported does vary by year, as you'll see on the next slide. So collection and publication of the HMDA data have undergone many changes since it started in 1981, and there are major shifts in the categories and types of information across 4 distinct eras are displayed here on the screen. And I did hold myself back from putting in a Taylor Swift Eras Tour joke on the slide, so you're welcome. The 4 major eras are from 1981 to 1989, 1990 to 2003, 2004 to 2017, and then 2018 to present. So the first thing to note is we have inconsistent geographic reporting over time. The first era of HMDA data contained census tract summaries, whereas later data was reported on individual loans. In addition, the census tract boundaries change with each decennial census. We also have differences in data collection requirements over time. So you can see in the first era, we only have the total number of loans and the amount of loans, and those were grouped by loan type. Whereas in the most recent era, we have information not only on the application or the loan, but also on, we have information on the applicant themselves as well. So all of these things made working with longitudinal HMDA data difficult. So our goal, led by Bruce and Jad at NCRC, was to compile annual HMDA data into a temporally and geographically normalized data set. And so we've done just that. And we call it the HMDA Longitudinal Data Set, or HLD. So the HLD reconciles HMDA data. It created a tract-level summarization of home mortgage lending for residential housing. And we have both annual estimates as well as decadal estimates. So 81 to 90, 90 to 2000, 2001 to 2010, 2011 to 2020. The longitudinal tract database crosswalk file was used to normalize the data to 2010 census tract boundaries. And so this maintains the spatial consistency of HMDA data across all census years. The originations that we have included in the HLD are mortgages made to owner-occupied single-family homes of 1 to 4 units that were site-built within each tract. So we do not include originations made for speculation, second homes, or vacation homes, and multifamily homes are excluded from the counts. And then another important piece of this is that all loan amounts were normalized to 2020 US dollars, again, to enable that longitudinal comparison. So we've pulled together this massive data source, and now I'll go over some example applications of the HLD data. So the first thing we can do is look at basic descriptive statistics for originations. So I have an example here on the left-hand side is just a graph of the average annual originations over time. On the right-hand side, you can see some information by each decade, including the number of valid tracts contributing to the data, the number of missing tracts, which you'll note changes over time, as well as the average, minimum, and maximum number of originations. We can also merge the HLD data to any other data set with 2010 census tract geocodes. So as an example, we're interested in understanding if mortgage originations varied by census tract historic redlining status. And here you can see we observe a monotonic relationship between the proportion of originations in Holt grades, such that formerly redlined areas have the lowest number of originations per housing unit. So there's much more lending occurring in Holt green or best graded tracts than in the formerly redlined areas. And in fact, when you look at lending over the full 40 years of the HMDA data in the HLD, the median difference in lending between the best graded census tracts and census tracts graded hazardous is 3,033 loans. So green areas are getting a lot more lending happening than in formerly redlined areas. So we love the data visualization. And we can also visualize disparities in lending spatially and temporally, including Holt grade. And this is a mapping tool that has done just that NCRC created. So each dot size corresponds to the number of originations in a given census tract in a given year. So I have 1982 showing right now, and this is for Milwaukee, Wisconsin. The purple shading of census tracts corresponds to the percentage of minoritized population. So for a darker shade, we have a higher proportion of minoritized population in a census tract. And then we also have the Holt grades outlined here. You can see the red areas, the green, the blue, and the yellow. So Milwaukee is a very segregated city, and you can see very clearly that formerly redlined areas are now majority Black residents and have very little lending occurring relative to the surrounding suburbs. We can also use the HLD to answer specific research questions. So we're interested in investigating racialized disparities in contemporary US mortgage lending and more thoroughly examining variation in racialized mortgage lending disparities by historic redlining grades. And so this work that I'm going to show you next is led by my postdoctoral fellow, Dr. Liang Chen, and he used the HLD and our prior historic redlining indicator data to answer these questions. And of note, we did exclude census tracts where there was no racial heterogeneity because we want to look at these comparisons. Okay, so with new data, we can develop new indicators of lending discrimination and racialized disparities in mortgage lending. So to capture the variation in lending by racialized group, we created a mortgage density index for each decade. So this measures the number of originations for each racialized group at the census tract level, adjusting for the proportion of the household number of racialized group, household number in that racialized group, and the total household number within a census tract. And so the take-home point here is that if your MDI is greater than 1, that racialized group has an advantage in mortgage acquisition relative to their proportion of the households in a given census tract. If the MDI is less than 1, the racialized group has a disproportionately less access to mortgage lending relative to their proportion of households in a census tract. So here are our national MDI data. So this is the median mortgage density index for each race ethnic group and by decade. So you can see here that all minoritized categories have disproportionately less access to mortgage lending relative to their proportion of households in a census tract. And you can see that over time, by decade, each access is improving for those racialized as Asian and Hispanic. However, for those racialized as African American, and we're using African American because that's what is used in HMDA, this disparity has worsened over time. For those racialized as white, you can see that the median MDI actually hovers around 1. So lending is about what we would expect given the proportion of households in a census tract. So here's the same graph, but it's just limited to Michigan. And we see similar trends in Michigan, though disadvantage in mortgage access isn't quite as severe as in the national data for those racialized as African American. So then, to make comparisons between lending in those racialized as African American and non-Hispanic whites, we can take a ratio of the two MDIs. And we call this the mortgage density index ratio. And we do this for each decade. And so if the MDIR is equal to 1, we have no gap in mortgage origination for those racialized as African Americans relative to non-Hispanic white. And if it's less than 1, we have disadvantage for those racialized as African Americans relative to non-Hispanic white. And if it's greater than 1, we have advantage for those racialized as African Americans relative to non-Hispanic whites. Okay. So here we have the national median MDIR for those racialized as African American versus non-Hispanic white by Holk grade for each decade. So you can see that for each decade, there's an overall disparity in lending to those racialized as African American, and the disparity is greater in formally redlined areas, many of which are primarily minority communities. I'm not showing it here, but in other analyses, we see that the largest African American, non-Hispanic white MDIR in formally degraded census tracts happens in neighborhoods with more than 50% proportion of Black population. So the take home here is that there's less lending going to African American households in primarily Black census tracts, particularly if they were formally redlined. And here's the same data, but just limited to Michigan. And we see the same patterns as the national trends, though they're just slightly less pronounced. We also see that in starting in 2001, there's less of that decline between the green areas and the red areas, and the medians are all kind of hovering around together. So with this new data set, I wanted to go over some data considerations and limitations as we will make this publicly available. So the use of the annual data or the decadal data is really going to depend on your research question. And so I encourage future users to think critically about which data is going to best work for your research question. HMDA is the most comprehensive resource of mortgage loans in the United States, but it does not contain all the mortgages made. And so that's just an important limitation to note. And as we mentioned before, there's shift in HMDA data reporting by eras. And so there are some nuances to consider. There's some overcounts in the number of census tracts in the earlier data, and some of this is due to the realignment because of the census boundaries. And then because of the limitations in the early reporting, we personally kind of feel like you use the 1980s data with caution, knowing the limitations in the reporting that we've kind of talked about before. And then the HLD focuses again on loans made to owner-occupied single-family dwellings of 1 to 4 units that were site-built. The HLD does not include mortgages made for purchase of multifamily dwelling or manufactured homes. However, condos and townhomes in multi-unit buildings are included. So the intentional, explicit, and implicit racialization of physical space to enact and reinforce racial boundaries and racial hierarchy has occurred over centuries. And this figure shows the chronology of major race ethnic segregation strategies, laws, and Supreme Court decisions over time. And so when we're thinking about structural racism, particularly in the housing market, you know, I always like to make the point that redlining is one piece of the puzzle here, but it is a piece of the puzzle for which we have a good remaining historical record. And so now we've added another piece to this puzzle by creating the longitudinal data on modern lending discrimination. But again, we still don't have data for many other important historical processes like racial covenants and block busting. So just keep in mind, you know, that this data is only a proxy maybe for ongoing processes. So where are we headed in the future? So our previous work found that historic redlining grade was associated with lending discrimination in 2018. And when we looked at the combination of redlining and current lending discrimination, we found that census tracts with sustained disinvestment, so those tracts were redlined and had current lending discrimination, had higher prevalence of poor mental and physical health. And this is data from Milwaukee. But this was really just scratching the surface of what can be done. And so we're excited to look at not only longitudinal mortgage discrimination and health outcomes, but also, you know, combine these historic data that we have with the longitudinal data and try and understand these processes and mechanisms that might be occurring. So we believe in democratizing data and making it available for entities beyond academia. And so we are releasing the HLD publicly in cooperation with the National Neighborhood Data Archive, or NANDA, and ICPSR. The current expected release date is end of April or early May. And so we're excited to share that with the world. And the NCRC mapping tool that I showed earlier will also go live at that point. And then I just also want to put a plug in for our existing publicly available historic redlining indicator data for hundreds of cities at the census tract level. And they've been normalized to either, we have it for 2000 census tract boundaries, 2010 boundaries, and 2020 boundaries, again, to democratize data and ensure access to any who might be interested. So with that, I thank you, and I'll look forward to your questions at the Q&A.
Wow, thank you so much, Dr. Meier. That is such an incredibly rich data set. I can't even imagine how much it took to put that together. And I have so much respect and admiration for the way you've made that publicly accessible. But also, I just looked at the ICPSR site and it's already, you've embedded so many elements that really make it accessible and functional for researchers using a broad range of statistical tools and approaches. So thank you for sharing that. I have so many questions, but I do want to turn it over to Ms. Simington. Jasmine's research explores racial and spatial inequalities in housing. Her dissertation, which I've seen a lot of and is absolutely incredible, is a mixed methods exploration of heirs property ownership in Charleston, South Carolina. She's also written about attitudes towards reparations across Southeast Michigan and the disaster recovery process in Marion County, South Carolina. Jasmine previously worked in the Metropolitan Housing and Communities Policy Center at the Urban Institute, studying federal housing policies, neighborhood quality, and residential mobility. Thank you so much, Jasmine, for being here. I'm going to turn it over to you.
Thanks, Mara. I'm going to get my slides up. Again, thanks, Mara, and thanks to the Housing Solutions for Health Equity Initiative for the invitation to share this collaborative work on reparations across Michigan. So today I'll be sharing results from a couple different survey analyses about support for reparations in Detroit, Flint, and Ypsilanti. We just learned from Dr. Meier about these stark racial inequalities in mortgage lending and how these contemporary inequalities are connected to past discriminatory policies by the federal government. And as we think about how to close these current gaps, we should consider how to atone for past historical injustices in the housing market. And a reparations policy can help us do that. So I'd like to start off with just a quick primer on reparations before I jump into some of our data results. Calls for reparations to descendants of the enslaved are a way of seeking restitution for historical harms and ongoing injustices. Many scholars see reparations as the most comprehensive way to close the racial wealth gap, especially because of how central home ownership is to building wealth and how past discrimination in federal housing policies have ultimately barred Black households from building wealth, as we saw in Dr. Meier's presentation. There's been a revival of calls for reparations since the summer of 2020. But I do want to acknowledge that the earliest demand for reparations actually date back to 1865. So just after emancipation, Black leaders in the South were calling for the federal government to redistribute land to the formerly enslaved so that they could farm and become economically self-sufficient. Perhaps surprisingly, there's some evidence of successful claims to reparations at the individual level just around this time. So in a story chronicled by Pulitzer Prize award-winning author Caleb Daniel in the book, The Sweet Taste of Liberty, formerly enslaved Henrietta Wood was compensated in the amount of $2,500 for lost wages during her 13-year period of enslavement. So in today's dollars, that would be about $65,000. You can imagine not all claims for reparations back then were successful. Another example is Callie House, who after becoming emancipated, she organized other freed people and filed a class action lawsuit in 1915 against the US Treasury Department. The claim was denied, but again, it just represents that all the way back in the early 1900s, people were making claims on the government as a form of reparations. In contemporary times, we see that there are these calls for reparations from the federal government, municipalities, states, universities, and even insurance companies. And I'm sure the list will get longer. But the central question is just, how should these different entities that are responsible for perpetrating racial harms, how should they go about developing reparations policies? And so this is the context in which a team of researchers here at the University of Michigan began exploring attitudes towards reparations in 3 cities across the state of Michigan. Our team is built up of researchers from the Center for Racial Justice and Poverty Solutions, including Dr. Ostfeld, as well as Erica Benson in the Sociology Department. And our guiding research questions have been, what does support for reparations look like in Detroit, Flint, and Ypsi? What are the demographic and social factors that shape support for reparations? And does support for reparations vary by proposed initiative design? For our analyses of reparations attitudes in Flint and Ypsilanti, we rely on data from the Michigan Metropolitan Area Community Study, MIMAX for short. And to understand reparation attitudes in Detroit, we use the Detroit Metropolitan Area Community Study, which you heard a little bit about earlier, and you'll hear me call that DMAX for short. In both MIMAX and DMAX, we have representative survey data that is weighted to reflect the respective citywide populations. Our Flint sample has 572 respondents, Ypsi 755, and in Detroit 1,911 respondents. For all cities, we asked questions about support for reparations in general, and then support for specific kinds of reparative policies. Respondents could rate their support on a scale of 1 to 5, from strongly support to strongly oppose. Both surveys include demographic information about race, gender, age, income, and education status. And the DMAX survey in particular asks respondents about perceptions of racial inequality. And we're able to use that data to help us understand the second research question about social factors beyond demographics that shape reparations support. So all the figures I present today will be displaying statistically significant results from our descriptive analyses. So they'll be simple, but I think really powerful descriptives of some regression analyses that I won't show, but I'm happy to talk about. So what does reparations support look like in Detroit? Overall, 63% of Detroiters support reparations, which were defined as some form of payment to Black Americans to counter the impact of slavery and discriminatory policies. 22% say that they neither oppose nor support reparations, and 13% oppose reparations. This level of support in Detroit is actually much higher than what we see in national samples. In a 2021 Pew survey, they found that about 30% of US adults supported reparations. So we do see a relatively more hopeful outlook in Detroit relative to national data. Next, how does reparations support vary by demographic characteristics? So if we just focus on this data within the red box, we see that there are differences in support for reparations by race. You see that the vast majority of the city's Black residents support reparations, 72% in that dark blue section, compared to 38% of the city's white residents supporting reparations, which is the dark blue section of the first column. As I mentioned, we're also interested in whether support for reparations hinges on an awareness of racial inequality. So here I've highlighted for you the relationship between Detroiters' beliefs about the legacy of slavery and reparations support. So I will walk you through these columns. So in the dark blue portion of the first column, you see that 73% of Detroiters who agree that the legacy of slavery continues to affect Black Americans support reparations. By contrast, the dark blue portion of the middle column reveals that just 26% of Detroiters that are ambivalent about the ongoing effects of slavery support reparations. And then if we look at the third column, the lighter blue section is showing us that 41% of Detroiters who disagree that the legacy of slavery have ongoing effects, they oppose reparations. Next, I told you that third research question is about how does support for reparations vary by specific type of policy? So whereas previously we were asking about reparations in general, support for reparations as a concept, we later got to ask respondents about their level of support for reparations across different forms. And so in Detroit, we actually find that financial assistance for buying or improving a home and financial assistance for post-secondary education are the most popular forms of reparations when you ask people about specific policies. 3 out of 4 Detroiters say they would support this kind of reparative policy. Also, I just want to note that investment into Black neighborhoods is supported by 74% of Detroiters, so just under the top 2 most popular. Now I'm going to walk you through basically the same kind of data, but for the city of Flint. In Flint, 53% of residents overall support reparations. So that's a little bit lower than what we saw in Detroit. But 22% of residents oppose reparations and 22% neither oppose nor support it. Like Detroit, support for reparations in Flint does vary by race, but it also varies by education and income, which is not something we saw in Detroit. If you look in that red box, you'll see that Flint residents with a bachelor's degree or more are more likely to support reparations compared to other education groups. So that group, about 74% of those with a bachelor's degree or higher, support reparations in Flint. We also see from this figure that Black Flint residents are more likely than white Flint residents to support reparations. About 67% of Black Flint residents support reparations compared to 31% of white Flint residents. If we again look at differences in support for reparations by type of policy, we actually see really similar patterns in Flint as in Detroit. So again, financial assistance for buying and improving a home and for post-secondary education are the most popular forms of reparations. And as you might have seen in the Detroit figure, but I'm not sure I said it, so I'll say it here, cash payments, still a majority of support for cash payments, but certainly supported at a lower level than financial assistance for buying a home and education. And finally, I'll take you through the data from Ipsy. And at the end, I'll sort of tie all these things together so we have a cohesive understanding. 59% of Ypsilanti residents overall support reparations. So that's just in the middle of Detroit and Flint. 22% of Ipsy residents neither oppose nor support, and 18% say they oppose reparations in general. In Ypsilanti, support for reparations varies by race and gender. So we saw the racial gaps in both Detroit and Flint, but gender is something that we saw distinctly in Ypsilanti. So in that dark blue portion, you see that 70% of Black Ypsilanti residents support reparations, compared to 53% of white Ypsilanti residents. Similarly, we see that women are more likely than men in Ypsilanti to support reparations. 65% of women, compared to just 50% of men, say that they support reparations. I'll also flag here, 24% of men oppose reparations compared to 13% of women saying that they oppose reparations. Like Detroit and Flint, again, we're seeing a similar trend here, which is that financial support for post-secondary education was again widely supported in Ypsilanti when you ask about specific types of reparations. And also investments into Black neighborhoods, again, ranking high in support for specific reparative policies among Ypsilanti residents. Altogether, what we've learned through this analysis is that a majority of folks in Flint, Ypsilanti, and Detroit support reparations. But this support does vary by demographic factors like race, education, income, and gender. And the support varies according to how people make sense of past injustices and their relationship to contemporary inequalities. And so this finding in particular, that awareness of racial inequality shapes support for reparations, we think underscores the stakes of the current debates about legislative bans on how we teach the history of US racism. It's important to say that how people remember historical events and their awareness of ongoing events shapes how they think about appropriate redress. Second, language matters. You'll see that, or I hope you've seen that, respondents were more supportive of specific kinds of reparative policies than the general idea of reparation. Policy preferences are complex and filtered through language. So we see that the concept that government should make amends is perceived slightly differently than when you ask people about specific kinds of policies. And then lastly, we're here to think about homeownership and the wealth gap. And you see that financial assistance for buying and improving a home was consistently among the most popular forms of reparative policies, which I think illustrates that housing policy in particular is a place where people believe amends need to be made. And I think Dr. Meier's presentation illustrates that as well. With that, I'll end. Thank you so much for your time and looking forward to your questions.
Thank you so much, Jasmine. I love hearing you talk about this research. I want to start off, and I know you didn't go into your own research, but since it's fresh in our minds, I want to ask how you think how the research that you just presented on attitudes towards reparations relates to or connects with your other research on heirs properties. And if you can start off by just clarifying for what you are referring to when you refer to heirs properties.
Yes, thanks. Thanks, Mara. So heirs property is sort of the technical term for people who inherit their homes outside of the legal process after a family member dies. So if someone doesn't have a will, but that property is transferred to their living family members, we call that housing tenure heirs property. And I think it is it's so connected to the question of reparations because heirs property owners face a lot of barriers when they try to navigate housing. And so whereas we learned from Dr. Meier that there's a lot of racial discrimination in the housing market, we can now look at heirs property owners and see, okay, even if you do become a homeowner, there's still all these barriers that prevent you from actually receiving the returns to homeownership that many people do. It's also a really big, it's played a big role in Black land loss in the rural South. And so the destruction of wealth through homeownership for heirs property owners is a really big issue. And when we think about reparations as closing the racial wealth gap and trying to undo some of the problems in housing, I think heirs property owners are first in line or can be first in line for reparations in the housing space.
That's a fascinating and such a poorly understood and told story. And I'm really grateful for you for amplifying that in some of the public conversations on this topic. It makes me wonder, Dr. Meier, there's so much that you were able to include in your rich data set. And I imagine there's things that you weren't able to include or other things that you just want to see your data overlapped with to understand the relationship between mortgage lending practices and things like heirs properties or other things. Are there other things, or can you say more about other things you want to see your data combined with and other things that you want to see coming out of or your data used for types of research?
Yeah, that's a great question. So the grant that we have is geared towards addressing the very siloed nature of data in this space. And so, it's to bring in the HMDA data, it's to bring in, information on sociodemographics of census tracts over time, thinking about the changes, so racialized displacement, and pulling that all together in a harmonized large data set that can be added to longitudinal studies of health as well. So, I mean, that's the perspective that we're taking on it. But I think part of making it publicly available and hopefully presenting it to diverse audiences is that things will, people will use it for things we won't even, we can't, like, I can't even think of off the top of my head, right? Like, we are all creative, and I can't wait to see how it's used. I do think that part of putting it out and being a producer of data, when the data documentation, when it becomes publicly available and the accompanying data documentation, I really do encourage users to read it thoroughly, because we do talk a lot about the limitations of the data and how you will want to, we want it to be used correctly. As an epidemiologist coming into like mortgage lending data, that's why I partner with NCRC, because they are the experts on this, right? And I don't want to fly blind and use it incorrectly, right? And I've seen that at some epidemiology conferences. They're looking at loan denials, which isn't quite the best use of this data. So we focus on originations. So there's a wealth of information out there, and I think I'm very excited to see what people do with it. I think that there's other really interesting ongoing projects. So I know Ladale Winling is leading a covenants project in Chicago. They have citizen scientists going to all the different locations where documents on covenants are kept in the city halls, and it's a huge undertaking. And so, it might be linked. While we've created a national data set, like hopefully maybe the data from Chicago could be linked with that as well. So I think the world's our oyster, and I'm excited to see what people do with it.
That's really exciting. We have someone, Ms. Patrice Hicks, in the audience highlighted they loved your presentation, and I think you mentioned this, but they wanted to know if the HMDA data will be available for the 2020 and 2020 census tracts. And I think you said it is, but can you remind everyone where they can?
Yeah, it's 2010 census tracts. Yep.
Only 2010, not 2020. Is that
correct?
Right?
Yep, just 2010 for the HLD as of now. Yep. Great,
thank you. We have another question from Linda Chatters, thanking you, Jasmine, for your awesome presentation. And they asked, do you have thoughts about the greater acceptance of reparations among women, and any information about how Black women in particular feel about reparations? Yeah, I'll let you answer that, but then I have something I want to build on that with.
Yeah, great. Thanks, Dr. Chatters, for the question. This is something we are really trying to think about. I think there's an immediate reaction is, I didn't show you any data about political ideology, but I think if we were to also look at differences in political ideology amongst men and women, that might explain some of the differences. And then I think an idea that we had thought about previously, but actually haven't looked at in the data yet, but I hope at some point we will be able to, is whether women might be more likely to support certain kinds of reparations that are connected to gendered roles in terms of mothering and caretaking, and whether that explains some of the differences. But I think you point out a really important question that I hope we'll explore even more. And Mara, maybe you have more to say.
I don't recall the gender gap, but I do want to highlight, you do point to these really big differences across Flint, Ypsi, and Detroit in support for reparations. And so what were the factors you found to be most closely linked to those different levels of support? Do you recall?
Yeah, I think, well, political ideology is one, but also I think when we look at the racial composition of the cities more broadly, that helps to explain some of the gaps we see across the city. So Detroit is a majority Black city, and Flint and Ypsi more diverse relative to Detroit. So some of those overall numbers, I think, are shaped by the broader composition of the city.
And just building on that point, I think it's interesting that you highlight that. Obviously, Detroit for reparations for Black Americans is pretty strong among Black Americans, but I think some people might be surprised that it was covered around 80%. So do you have any theories about why there might be some lack of support for reparations among Black Americans?
Yeah, this is another thing I think we're still thinking through. But one thing is, the history of government subsidy towards Black people has become heavily stigmatized. And so we do wonder whether some opposition to reparations among potential beneficiaries is about whether they perceive reparations as another stigmatized subsidy. And so that's something we can't capture in our current data, but we are thinking about whether there are underlying perceptions about reparations that is causing some opposition.
And I think it's really interesting that you find this really high level of support for reparations in the form of housing. And I wonder if you could think out loud about what that means, or share any thoughts you've had about what that means about the meaning of housing in society, both as like functionally what it serves, but also psychologically and socially what housing and home ownership especially means in our society.
Yes. Well, I think at the beginning of this session, we said that people see housing as a human right. And so I think on the sentimental side, safe shelter is important to people. And then I also think our government has created a, a legacy of housing as the way you build wealth. And so to the extent people want to participate in wealth building, I think homeownership is the first thing that comes to mind for a lot of people. And the data bears that out. It is the largest form of wealth for most people outside of the 1%. So I think sentimentally, people want a safe place to go to. And also, there is a narrative in our country that homeownership puts you on the pathway to upward mobility. So
I thought, Dr. Meier, I thought it was so powerful when you showed, I mean, we know that the racial wealth gap has only grown over time. And I thought it was so powerful how you showed that disparities in access to mortgages, especially among Black Americans, has also grown. I thought that was especially, I was surprised to see that it has actually decreased among Latinos and Asians. It made me also wonder how the data, and you are careful in your language. You talk about people who are racialized as Black or racialized as Asian. So I was wondering if you are able to say more about how those racial classifications are made.
Yeah. Loan applicants can self-report. And if they do not, then usually the loan officer would fill it in with their best guess. So it's not necessarily the cleanest data.
But it's still just as powerful. It's interesting because we know that racial classifications are powerful as a self-identity, but also the way it's described can also reflect how we see someone and how we how we're going to interact with them.
Yep.
I want to there's a couple other questions. Jasmine, someone asked, are there areas nationally that have some form of a reparations program? What has been the impact and what can we learn when we look at those other examples?
there certainly are. I mean, I think we're seeing reparations at the municipal level sprouting up in a lot of places in Asheville, North Carolina, in Evanston, Illinois, recently in Massachusetts, and at the state level in California. So I think my sense is that it's too early to know exactly what's happening in those programs. But I think that there is a lot to learn about the implementation of it. So questions about eligibility. A lot of those municipal programs are geared around housing. And so I think that's further illustrates the desire for reparations, either directly in the housing space or that can go to housing in some way. So I think the early takeaways are like housing is popular. And then I think we're still kind of waiting to see how these programs how they end up in terms of benefiting individuals, because they're just very early on in their implementation.
Really important point to have in mind when we think about all of this. I think it's interesting to note that one thing that I think is really powerful is, of course, there's broad support for housing, but when white Americans were asked, or white residents were asked about their support for reparations, they were really not supportive of cash transfers. They really like those more controlled, as we see with other redistributive policies. They really want to have control, as reported in public opinion, about how those benefits are being used. So there's this paternalistic element of support for housing that I think you nicely flesh out. Both of you did a really great job of outlining just the ways that institutionalized racism has manifested over time and continues to affect and accrue in the experiences of Black Americans and opportunities today. When you look at your research, and I'll start with you if it's okay, Dr. Meier, when you look at your research and when decision makers hear you present your research and policymakers hear you talk about some of your findings in your data, are there takeaways that you want them to have from your research?
I think the biggest thing is that, we have inequity today, but there's a long history of that, right? And so I think it's important to understand these historical drivers, but also, the solutions have to be based in today, right? So I think it's great have this paired with Jasmine's talk, because, you know, we can't go back necessarily and change that, but, you know, it's like, what can we do today to address these inequities that have been going on for a long time?
Thank you, Dr. Meier. I'm going to turn the same question to you, Jasmine. When you present your work, what are the things you want policymakers to take away from it?
Yeah, I'll co-sign Dr. Meier, and then I'll just add that I think this point about language matters is a really important takeaway. It matters. We need to be able to capture what people are imagining in their head when they think about reparations. And so the better job we do at capturing those details, I think the more successful the policy can be.
Great point. If I could just tack one thing, I think it's interesting to think about thinking about the history of how we've also, as Americans, as people proximate to American institutions, have shaped and constrained the political imagination and what people believe is possible, and how much it is on us to also support expanding perceptions of possibility and enabling that. And you guys, this has been such a generative talk, and I just really appreciate all of your thoughts and expertise and insights and the way you've really shared it for everybody. So thank you both, and I'll turn it back over to Dr. Bashanic.
Thank you, Jasmine and Dr. Meier, for your wonderful presentations, and Dr. Ostfeld, you were incredible as a moderator. Thank you so much. I would like to thank our speakers today for this wonderful session, and thank the viewers for joining us today. I would also love to just the biggest shout out to our HSHE team, especially Malika Belhaj, for leading the organization of today's event. And I'm sad to say, but happy to say for the future, today marks the final event of the 2023-24 Housing Solutions Speaker Series, and we're so happy to have been able to highlight the variety of housing research and practices and their connections to health and health equity throughout this event. We are grateful for our partners who have helped us promote this event, especially Poverty Solutions and the School of Public Health. If you have not done so yet, please keep in touch with us by signing up for our newsletter, and continue to look out for more events, especially our kickoff in the fall for the next speaker series. Again, a huge thank you to our speakers today and our moderator, and I will see you soon. Take care. Bye-bye.